Hello, I am going to be talking about a nutritional assessment for Delia. This is a 16-year-old girl that weighs 312 pounds and her BMI is 50.4, which indicates that she has severe obesity. Her medical history shows that she has PCOS, which means polycystic ovary syndrome. She has had fatty liver disease, secondary hypertension, and pediatric obstructive sleep apnea. She did come in to the ER and is eventually having a bariatric surgery, which is a weight loss. Basically, they take out all the fat in the stomach and have a surgery to just remove all of it when you are severely obese. So that's why all of these past history are important when diagnosing something nutritional for her. Her vitals did show a blood pressure of 144/89, which is pretty high. She also has a high BUN and creatine levels. Her glucose and lipid levels are pretty average. She has no known allergies. We don't have an average daily diet to account for, as well as activity levels and feelings towards food and exercise, which does make it a little difficult to do a nutrition diagnosis on her, but generally we can definitely notice that the diagnosis would be that she has an imbalance between her energy intake and expenditure, which creates too much energy intake. There's nothing coming out. It's just all coming in. There's no energy being released. And I came to this conclusion based on her BMI, diagnosis of severe obesity, and then all of her past history of hypertension, fatty liver disease, PCOS. All of those can really, there's some imbalances going on where we're not it's very unbalanced, I would say, and with her energy and what's coming out of it and activity levels, and we don't know her daily dietary intake, but from all the information given, that's what we can work with, and my job is to support Delia in creating healthier habits through her diet pre and post surgery. It is essential to go over nutritional goals before the surgery to establish education and eating patterns. A high protein, well-balanced meal pattern will help keep her lean body mass for when she's post-surgery and prepare for before the surgery happens. It will be important to start new habits that will be beneficial, like eating slower and bite sizes and separating fluids from meals. All of these things are going to be different things she's going to have to adjust to post-surgery, with her stomach being very weak and different and having all these. She's not going to be able to eat as much, as fast, and as big portions. So implementing that before surgery will help establish those patterns. Some goals are adding a lean protein source to all of her meals, making sure she is getting protein in every meal, making sure she's having balanced plates of vegetable, whole grain, protein, and healthy fat. Avoid sugary drinks and maybe implement more of just hydrating with water before surgery and after surgery will really help her body recover. And then practice portion control and slowing down when eating and chewing. It is important to consider all of these factors when counseling Delia, like her family and potential cultural practices. It is important to avoid any assumptions, which can be sometimes not challenging, but known in cases like this with severe obesity, to assume why she weighs the amount that she weighs, why she's there, all the different biases and assumptions, but it's important to just focus on the goals of making her heal better with the facts that we have and just providing as respectful advice for the patient as possible. For nutrition monitoring, we will be keeping a watch on her changes in BMI and weight, see how she does with initial recommendations, just how she reacts to change and is willing or less willing to actually work on the nutritional goals and recommendations that we go over. And then watching her protein intake will be important, and then keeping a look at her labs. a lot of making sure that her kidney levels are okay, just all the levels, just pre and post surgery. There can definitely be complications, and then also a whole new diet that she may have just not ever been, her body just has not reacted to. So just making sure that everything is steady, and just all the different behaviors mentally, physically, throughout this time for her.